Hi, it's Joe Mullings from another episode of The Other Side. Today, in this episode, I've got Joe Urban with me. Joe is the CEO of Potrero, and Potrero is an amazing organization that is treating acute kidney injury. And Joe and his organization are right on the front line, helping the initiative to saving lives and helping patients recover. Joe, thanks for joining us in such short notice.
So thanks for having me.
Yeah. So, Joe, share with the audience a little bit about your background, which set you up
Sure.
to lead Potrero.
Yeah, so primarily my entire career has been in the operating room and ICU. Was a combat veteran from Afghanistan, '02 to '03, and I think those experiences helped prepare me for MedTech and med device, and just trying to keep a cool head in a high pressure situation. And so I've been the CEO of Potrero for a little over 2.5 years, and our mission is to protect the kidney. What we've done at Potrero is we've taken a traditional Foley catheter, and we've placed sensors inside that Foley catheter, and we're automating the final vital sign. And why that's so important with COVID-19 especially is if you look at the data that's coming out of Wuhan and some of the initial cases, 50% of the patients that died had AKI, acute kidney injury. And I believe it was 29% of all patients had an injury to their kidney.
And we've been just hearing about respiratory, sorry, Joe, but we've only been hearing about pulmonary and respiratory issues, but kidney, people are dying from that.
Well, I don't know if they're dying from the kidney injury. They're dying with a kidney injury. I think what this COVID virus, why it's so dangerous, is it attacks the lungs really hard, and the patient starts to spiral. And they can't get the oxygen delivered to the other organs. And so the kidneys are an important function. They filter your blood. They send signals constantly throughout your entire body to every structure and organ. And they're the first organ that shows a decline in performance. And that's what we look at is the urine output, the function of the kidney. And what we're doing is we're automating that vital sign. And so the kidneys will start to show a decline in the ARDS patient population. Urine output is critically important. And what we're seeing and what we're hearing, I've been on the phone pretty much nonstop with ICU physicians and nurses since Friday as they start to prepare for the surge that is going to happen. And we're having conversations about something that they've just never encountered to this extent. And we're looking at what happened in China and other parts of the world, Italy, and just how overwhelmed and how quickly a number of hospitals can be completely overwhelmed. And not only that, but the precautions they have to take from a protective measure standpoint, biocontaining a patient in a quarantined room. Some of the physicians were saying that they need to know everything before they go into the room, because once they come out, if they forget something, it's another risk for that clinician going back in. And so automating this vital sign and taking care of some of the manual tasks has proven critical for us.
The conversation you and I had yesterday when I reached out to you to set this up, you had mentioned to me that your team has been working tirelessly, even just to ship monitors to the front line in the hotspots. Can you share a little bit more about that effort that your team's got going on?
Yeah, so we're a startup, and we don't have we're doing everything we can. We think that it's our responsibility to do that, and I hope that other MedTech industry leaders will follow suit. I'm sure they will. But we converted a number of our monitors and inventory to loaners, and we're shipping those to the hospitals. We can't meet 100% of the need, but we've reached out. We spent pretty much all weekend in conversations with hospitals from around the United States and getting them some monitors so they could have them when the patients start hitting. And so it's kept us pretty busy.
And you've got some real warriors on the nephrology side, I guess you would call it, on the front line that are close to your organization. Are there individuals in particular that you're working closely with, or institutions that you'd want to share?
We'll keep the institutions quiet because I haven't had that conversation with them. But what I would say is mostly the nephrologists, they're worried that there's, for example, ventilators are in the news. There's not enough ventilators. There's not enough ICUs. A number of the doctors I talked to are in conversations with hospital administration to convert the operating rooms to ICUs. One, to get more ventilators, but two, they just don't have the space because they're stressed to the max. And so a number of the nephrologists are concerned about, super concerned with the kidney, and they're very concerned not just with our technology, but not having enough dialysis machines or continuous renal replacement therapy, and just how under-resourced the ICU currently is. And so I think it's forcing a lot of conversations nationally, and you can't turn on the news without seeing something about the ICU and how they're working to become prepared. And it's, seeing everything in the operating room for the last 20 years, you've seen a ton of innovation there, and the ICU is just now becoming the next frontier, I think, in the hospital.
You and I are fortunate enough, or sometimes unfortunate enough, but I think for this scenario, fortunate enough to be in the know on a lot of things. And I've watched the public be incredibly unaware, or I wouldn't say misinformed, but lack of information sometimes the same as misinformation. Is there anything that you would want to share with the consumer that they should be aware of? Is there a tsunami coming? What is that scenario? I've got my own opinion on this, and I think
Sure.
it's coming strong, but what are you thinking?
Yeah, when I've had conversations with the nurses, you can hear the stress in their voice. They're already starting to see above and beyond their normal volume, just an influx, because anybody that has a symptom is heading to the hospital right off the bat. And they are we're in the epicenter in California. We're I don't know if you saw the news, but we're shelter in place, and so all people that can work from home should work from home, and that's so our healthcare system doesn't absolutely crash, I believe. I think what's going to happen, and just from having the conversations with our thought leaders in China and also in throughout Europe, this can get out of hand very quickly if it's not contained. And I think the measures that are now being put in place will actually save a lot of people. And so that's what I'm hearing. I have to tell you, Joe, I'm sure you agree with this. It's been a wonderful thing to see the medical professionals show up and bravely face this terrible disease and do everything in their power to defeat the virus. To me, that has been inspiring. It's inspired us at Potrero. We have engineers. I just posted a picture on LinkedIn. We moved all the engineers to their home office, or to their home, and they're setting up R&D labs in their kitchen. And the work still is going on. The dedication to protecting the kidney is still happening. I have the shipping and receiving and some of the ops people here, so we can get the monitors to the hospitals. And we're just doing the best we can under these circumstances. But I think from the what's about to happen, we're seeing it in San Francisco right now. The hospitals are starting to get stressed. The influx is starting to hit, and we're very fortunate to have the medical professionals we have, and they're sharing a ton of information, but there's a lot of noise, a ton of noise. Not just the national media, but just everyone has an opinion, and so cutting through that noise is, I think, going to be important to share the information.
Yeah, one of the things that you and I ideated over the weekend, and I'm super thankful for you because you're always a forward thinker, is we came up with COVID Oregon 19. And
COVID-19 organ, I
thanks,
think,
Joe.
isn't it?
COVID-19 organ, and Joe shared that with me.
Yeah,
The disease, as Joe points out, first declares itself in the respiratory region, pulmonary, but then quickly that triad of the heart and the kidney all are connected. And so one of the goals that we have that Joe and I ideated was the medical professionals who are not going to sell you hype, but share with you real facts, some of it in a clinical setting and some of it just for the consumer so you can consume it yourself,
that's
so you
right.
can be better educated.
Yeah, I have to tell you, like I was like everybody trying to get information everywhere I could, following doctors on Twitter. A lot of physicians are communicating to each other via Twitter. Some of it's useful, others, it's just opinion because they haven't seen it. Those on the front lines in Seattle, they were sharing a ton of information. The nephrology community for us was all over this. And one thing that I saw that I was super impressed with was what Neph Twitter, it's a group on Twitter, what they were doing with Dr. Toff and Dr. Hiremath. They put together a repository, all things kidney for the COVID-19 patient. And that's what we discussed this weekend, that wouldn't it be great if others followed suit, and I'm sure they have, but they're in silos. And so if you think of how hospitals run, when the kidneys fail, you call in the nephrologist. When there's upper respiratory, you call in the interventional pulmonologist and the cardiologist for the heart. But everybody's trying to do the best they can. And in this high stress environment, I think you took it and 10x the idea and made it the COVID-19 organ. And I think that if we can do that just as an industry, share that out as widely as possible to our physicians, our nurses, our hospital administrators, just a place for them to go and cut through the noise. I think if we do nothing else outside of providing medical equipment in the time of need, that would be hugely beneficial to get that information to them.
Yeah, and thanks again for that idea. As usual, you're a force multiplier with these ideas. You and I have had the good fortune of sitting in this industry for 3 decades, each of us respectfully. And now it's coming to the forefront in everybody's home. Obviously, the caregivers, the physicians, the nurses, the surgeons. And you and I have known about the medical device industry for a long time and the heroes that live in it. So I think that this crisis is going to start to elevate heroes to come out, not just in the .com industry, and maybe not in the self-driving cars industry, and those should certainly be heroes for different reasons, but the engineers that you and I and the marketing people and salespeople that you and I have held in such high regard because they all had a chance to go into another industry, but they chose to stay in this one.
Right.
This is their time.
100%. And I'll tell you, like I look at the entire industry: doctors, nurses, hospital administrators, pharma, biotech, med device, MedTech, software, everything. And you're starting to see the heroes rise to the top. And any situation like this will hopefully bring humanity together. And it's just really nice to see everybody working together and with a common goal of defeating this terrible virus. And for me, I'm so proud of the Potrero team and how this is a rallying cry. And in Afghanistan, I think you and I were talking about this. Sometimes in a time of crisis, you have to clap your hands in front of somebody's face because they momentarily freeze, and it's in those moments and how you respond that is truly inspiring to me. I love seeing the way that the doctors are charging into the hospital. It's like the old analogy of firemen. Everyone's running out and they're running in. And you're seeing that, not all heroes wear capes, and a lot of them are in scrubs.
Yeah.
And to me, that is just, it's why I'm in this industry. It's why we do what we do. It's the rallying cry for Potrero and a number of other companies that are at the forefront of innovation and driving patient care, just trying to eliminate some of these what could be distractions of limitations of current technology. And how do you make it easier and better?
Yeah. Well, Joe, as usual, you were one of the first medical device executives to step up for this initiative, and I was not surprised. I'm not going to keep you much longer because I know you have lives to save. Anything before we head out you want to share with the community?
No, just I think if we can get the COVID-19 organ and that education out to all of our contacts, I think that would be fantastic. If there are doctors and nurses that are on that are seeing this, we'll do what we can. We're a startup. We're providing the evaluation / loaner monitors for as long as we legally can, and we'll get those to you as soon as we can. So I'll make sure that we put it in the comment section and get that out to the hospitals as much as we can.
Awesome, Joe. Well, thank you, my brother. I appreciate it. And
thank you, Joe.
I'll give you a call back, and you can let me know how things are moving on the front in a couple more days.
Absolutely. And just one more thing, Joe. I was going to tell you that we're going to be doing a webcast, and I think it would be interesting for you. We have a doctor from Wuhan that was in the ICU, and I think it would be good to also share that information with you and just the experiences that they had. But it might also be somebody that you could amplify on your network and get that word out.
Awesome. We'll share that information as well, and I'll totally take you up on that.
Absolutely. Thanks, Joe.
All right, Joe, be well. Thanks again.
Yeah, thank you.